So let's start off here with the weight loss, activity modification, exercise therapy, and brace wear, okay? So this is an important slide I want to explain with regards to weight, okay? So 5 to 8 times of your body weight goes through your knee joint when you are in a single leg stance. What does that mean? When you're walking along and one foot is off, swinging to the other side, when all your weight's on that one leg, 5 to 8 times your body weight goes through your knee joint, okay? Why is that? Well, simply speaking, the end of your femur is round, the top of your tibia is square, and so it all comes to pressure at one single point, okay? So that's the bad news, but what's the good news? The good news is, if you lose 5 pounds, that takes 25 pounds of pressure off your knee. Okay, so think about it, don't think about it this way, think about it the other way. If you need to lose the weight, losing 5 pounds make a big difference on the pressure that goes through the joint. Now, average person takes 5,000 to 10,000 steps per day, okay? So you start thinking, treads on the tire, we're wearing things out, okay? So decreasing stress on these weight-bearing joints, exercise, and weight loss. These are things that we can do to kind of help prevent symptoms worsening for arthritis, okay? Exercise will keep the joints flexible, okay? It'll improve muscle strength. So as you improve the strength of your quadriceps and hamstring muscles, it decreases the load on your knee joint. So exercise, real important, okay? It's about a fitness lifestyle. It's a lifestyle change, okay? It's not just, I'm gonna do something for a week. It's a lifestyle change, okay? So the issue is this. Your knee joint has fluid, I always use these car analogies, like motor oil in them. And the more you move that knee around, the more that motor oil squirts around the knee, protecting the knee as well, okay? So it seems a little counterintuitive. Patients who have knee arthritis, the bone grinding on bone, what the kind of exercise they need to do is an exercise where their foot is in contact with something the whole time. What kind of exercise is that? Well, it's not walking, it's not running, swimming, stationary bike, an elliptical type machine, a Stairmaster, where your foot is not, there's no pounding. It's the pounding that really gets that grinding worse. So it's a good question, and they always ask me, well, doc, it hurts when I walk for exercise. This is the kind of stuff, so it's those kind of exercises you need to do. An exercise where your foot is in contact with something the whole time. So here, we're looking at a couple like a recumbent bike. This is a really good machine. It's a sit-down bike where you can pedal along. It'll keep those knees nice and limber. It'll help strengthen up your quadriceps and your hamstrings and keep that knee juice I was talking about sort of circulating throughout the knee, okay? So my favorite exercise to tell my patients are either swimming or a stationary bike, okay? Can therapy help? Yes, I do think physical therapy can help. Having a formal physical therapist teach you the correct exercise, the correct way to do it. It's not so much quantity when it comes to exercise, it's quality. Are you doing the right exercises and are you doing them correctly, okay? And quite frankly, physical therapy can help decrease the pain. Again, it's the concept of getting the stiffness out of that knee joint and getting that knee joint juice to kind of squirt around that knee and kind of protect it, okay? Again, we're talking about things that we can, we as the patient can do to help modify the symptoms of pain, okay? None of these things are going to prevent arthritis from happening, okay? They're going to prevent the symptoms from worsening, okay? Again, water type exercises are great for the knee. So we've tried the exercise, we've tried the weight loss. Let's go now, medications, okay? The traditional medications that we take are non-steroidal anti-inflammatory drugs. We call them NSAIDs, Motrin, Aleve, Advil, those kind of medications. There are tons of them out there on the market, probably about 50 that you can get over the counter, okay? Vioxx used to be a big one, maybe 7 to 10 years ago, that got taken off the market. I have a lot of patients coming in who had taken Vioxx in the past. There's another medication called Celebrex, works very similar. The issue with those medications, they can irritate your stomach and they can cause stomach type problems. For those patients, I tell them you ought to try some Tylenol products. Tylenol products are a pain reliever. They're not an anti-inflammatory, but again, we're not getting rid of arthritis. We're trying to get rid of the symptoms of pain. Okay, so Tylenol arthritis, Tylenol PM, Tylenol products are the first medications I'll try. Okay, again, just tons of other traditional NSAIDs that are out there on the market. Okay, my favorite one is Aleve, and the reason Aleve is my favorite one is because you only have to take it twice a day. Okay, Motrin, Or Advil, you got to take 3 or 4 times a day. It's hard to take a pill 4 times a day. It's just hard. So Aleve, pretty good. Celebrex, you only have to take once a day. So when I choose a medication, I try to choose a medication that's effective and that the patient will take. Because if a patient doesn't take the medications, it's not going to do them any good, okay? So these are all over the counter. These are not prescription medications. These are all over the counter, except for the Celebrex, okay? That's probably the newest and most popular medication that's not one of the traditional medications like Advil or Aleve, okay? And that is a prescription medication, and you can take that pill once a day, all right? So what's the deal with medications? Well, they can be very effective. Most patients, by the time they get into my office, have already tried some stuff, okay? But the prescription medications, the majority of them are covered by insurance, not all of them. They're not all the same. They don't all work the same. So it's up to your doctor to make sure you understand which medication you're taking and why you're taking it, and to make sure that it's not interacting with another medication you may be on. Very important for the doc to understand that, okay? So there's side effects on every medication, but you know, if you read the fine print of every pill that you take, it'll scare the heck out of you, and you end up not taking any of your medication. So that's when we rely on the FDA, that they've done the appropriate studies and all these medications are safe. But I mean, I'll read some of the fine print on some of the medications, and they do sound pretty bad, okay? So there's no magic answer, and I usually try to mix and match different medications until we find the right regimen that knocks out the pain. What I do not do is I don't do narcotics, and I would caution you about doing narcotics to help control arthritis pain, because arthritis is a chronic condition. Okay, again, your arthritis is not going to go away. We want the pain to go away, but if you start using narcotics to control the pain, it becomes a kind of a bad cycle. Okay, so. You know, sometimes if someone has a little flare-up, we'll give them a little bit of a pain pill. But you've heard a lot of the other kind of herbal type medications, and you know, there's a whole bunch out there. Chondroitin, glucosamine, all those medications. A lot of people have come in and they say, Doc, does this stuff really help? Okay, the jury is still out on whether it helps. There are studies that say that there is no difference between taking glucosamine and chondroitin compared to a placebo drug. There are studies that say just the opposite, that it does help. The majority of my patients who take it say it helps them. And so it certainly doesn't hurt. It's not a dangerous medication. It's over the counter. It's not covered by insurance. I don't know how expensive it is, but it can't hurt to take it. If it helps, then that's a win. Okay, can braces help with controlling arthritis pain? And the word that's circled there says unloader brace. Okay, so there's an unloader brace that I use, and it does exactly that. It unloads the knee joint. So here's a picture of this brace that's superimposed on the skeleton, but you can see how this brace has jacked open the inside, where before it was bone grinding on bone. Now it's kind of jacked open a little bit, less pain, okay? It's called an unloader brace.
How long can you wear that? Just during the day?
Yeah, I have my patients wear it as much as they can. Obviously, don't have to wear it at nighttime or they're sitting down, but anytime they're up doing something, I tell them to wear it, okay? And you can change how hard it jacks open that knee. There's a little dial on here, and you know, you can kind of dial it up and make it do more and more and more, okay? The issue about braces is they're not cheap, okay? Insurance will pay for a percentage of them, and they don't always fit patients well, okay? And so some people will get a brace, and I think for leaner patients, the brace fits better, okay? But I'll have a lot of patients come in and I try the brace, and they'll come in and it's already slid down to their ankle, and they can't keep it up, okay? So, you know, but that is a good option, is the unloader brace, all right? Something very simple as orthotic, or an insert in your shoe, believe it or not, can help jack open this space. So a lot of times I'll start off with little, I call them heel wedges, and they're just little inserts. They just go in the back part of your shoe, but the deal is they're going to be thicker on one side or the other, okay? Depending on if your arthritis is on the inside of your knee joint or outside, okay? And if I take one of those inserts and it changes the position of your foot just a little bit, it can then unload where you have the arthritis, okay? So if you have arthritis just in one area of the knee, sometimes a little insert in your shoe may help take the pressure off. Okay, what's the next step? So we've tried all this stuff, so now we're going to injections. So what kind of injections are out there? Okay, I saw 20 patients this morning, I injected 10 of them. So injections we use a lot. Okay? The two main injections we use for arthritis are steroid injections. It says corticosteroid, but steroid injections, and viscosupplementation. That's a I talked about the juice, that the knee motion squirts around. So the drug companies have synthetically made some of that juice that we can inject into the knee to lubricate the knee joint. So these are two main injections that I use and most of us use to help control the symptoms of pain from knee arthritis. Okay, so just here sticking a little steroid in someone's knee. The gel, people call them gel shots, or you hear people call them rooster comb injections or the rooster shots. It's called viscose supplementation, and what that is it's a viscous gel, and you can see here. I mean, this is kind of a picture, kind of showing you, that it's kind of sticky and viscous, like motor oil almost. There's about 5 companies who make this gel shot, okay, and they range from a single injection to up to 5 injections, okay. So obviously, I always choose a single injection because my patients are much happier only having 1 injection rather than 5 injections, okay. Yeah, they do. The biggest side effect is anytime you stick a needle into a joint, you run the risk of infection, okay? Well, we sterilize the knee, and that never or rarely happens. But some of these injections can have a side effect of what we call a pseudo infection. And what that is your knee reacts to this foreign substance and kind of gets inflamed. Usually lasts about 3 or 4 days, maybe a week, and then it kind of goes away. So that's the main side effect. But to counteract that side effect, what we do a lot of times the week before the gel shot is give you a cortisone shot to fight off the inflammatory response you may have from the gel shot. So in 5 years from injections, I've had no infections. I've had one of those little false infections, okay? So the newest one out there now is called Synvisc 1. It's a single injection, okay? It works in my patient population. I'll say it works about 60% of the time. When I started in practice 6 years ago, I didn't do those injections because the majority of patients, by the time they got to the surgeon, were needing surgery. But what I found out was those patients weren't ready for surgery, and they wanted something else. I'm not ready to have major surgery. So then I started doing these gel shots. So I think the more severe your arthritis is, the less these injections work. Okay. So injections are done in the office. You don't go to the operating room. You do them right there in the office. Okay. Very rare complications. Cortisone sometimes will just knock it out of the park. I mean, I have some patients who don't want to have their knee replaced. They come see me once every 4 months for a cortisone shot, and that's how they're going to treat their arthritis, and it does them fine. Okay. Again, like we talked about, those gel shots can be 1 versus 3 versus 5 injections, depending on the company and what they recommend. It is a temporizing measure. Okay, but for some patients, it's enough, and getting a cortisone shot once or twice a year to some patients is fine if they avoid the knee replacement surgery.